And thank you everyone for joining us here today. I'm Brittany Volk, a member of our clinical education team here at Virta, and I will be moderating our panel here today. We had several hundred people sign up for this webinar, so we're delighted to see that so many of you are interested in this topic. So again, thank you so much for joining us. Today we're going to discuss the future of diabetes care in the workspace. The status quo of diabetes care is changing, and we know that our traditional care models simply haven't worked for quite some time, and every year we invest billions of dollars in drug R&D, but diabetes prevalence continues to climb at a staggering rate. And here at Virta, we have quite a contrarian view on this. We don't think that the silver bullet will be the next new pill. Instead of piling on more and more medications, we believe it's about getting patients off of their medications by addressing the root cause of type 2 diabetes. And this concept is really baked into the core of Virta's diabetes reversal treatment. Diabetes reversal promises transformative outcomes. In our peer-reviewed outcomes, at 1 year, 94% of Virta patients have either reduced or eliminated their need for insulin, which translates into not only a tremendous cost savings, but also an improvement in quality of life for those patients. And the industry is catching on for sure. So as you may have heard about our recent launch with Blue Cross North Carolina, which starts in November, so just a few days away, they will be rolling out Virta's diabetes reversal treatment to their members at no cost. And we're super excited to partner with them to address the diabetes epidemic in North Carolina. Okay, so let's review our agenda for today. We're going to kick it off with a 360 view of what the diabetes vendor landscape looks like. Consultant Kara Speer from Willis Towers Watson will be sharing the latest intel on this. And then we're going to dive into our clinical outcomes of Virta's diabetes reversal treatment that we've aggregated across 7 different employers spanning multiple geographies, industries, and demographics. Then we're going to move on to customer and patient testimonials, first from Chris Ruckus, from Benefits Director at Honeywell, formerly at Sealed Air, and then on to our Virta patients, Ty and Robert. Lastly, we'll close out with a live Q&A with all of our panelists. So thank you. And we're going to hand it off to our first panelist, Kara Speer. Now, Kara is the Director of Health Management at Willis Towers Watson. She's a strategic advisor on all matters related to health management initiatives, vendor management, and program design. She is one of the key thought leaders at Willis Towers Watson and has helped really shape their point of view on metabolic syndrome and diabetes. So thank you, Kara, for all that you do, and welcome. I'm going to turn it over to you.
Great. Thanks, Britt. Appreciate it. So where we wanted to just quickly start is really some high level, what is the concern? Why are employers concerned and individuals concerned around obesity, metabolic syndrome, pre-diabetes, and diabetes? So we won't spend too much time here, but wanted to just level set with a few things. So if we start with pre-diabetes being for those folks whose blood glucose levels are higher than normal, but not quite to that level of being diagnosed with type 2 diabetes. You can see here that 88 million adults in the US have pre-diabetes. Nearly 85% are unaware of it, simply because there's typically not a lot of symptoms, typically no symptoms for this, and they find it when they have an A1C or a fasting blood glucose measured. Obesity is a common risk factor for type 2 diabetes as well. We continue to see the prevalence of obesity rise in the United States. So every state in the US has higher than 20% prevalence now. Many of you have probably seen the maps might look a little similar to the map on the right of this slide, but from the CDC, that as you keep going year after year and it gets darker and darker, showcasing the prevalence of obesity across the different states, and more than 42% of US adults are obese. There's also a cost that comes with that as well, as medical costs for people with obesity are over $1,400 higher than for those of normal weight. Metabolic syndrome, this is a group of risk factors: a large waistline, high triglycerides, low HDL, or that good cholesterol, high blood pressure, and high fasting glucose. And so as you have a combination of those, this increases your chance pretty significantly of developing type 2 diabetes as well as cardiovascular disease. And then when we look at diabetes in general, so diabetes, there's type 1, which makes up maybe 5 to 10% or so of diabetes, and type 2, which is 90 to 95% of those that have diabetes have type 2 diabetes. And as Britt mentioned, the prevalence in particular for type 2 continues to increase overall, including in younger age groups as well. We are now at over 34 million adults in the US that have diabetes today. If we look to the right side of the slide, the map here is showing the percent of adults by state that have diabetes as of 2019. And you can see majority are in that sort of orange or red. So 8% or higher prevalence in each of these states, with a couple of exceptions, some of that lighter yellow shade. As Britt mentioned, quality of life is hugely important here as we think about managing and reversing type 2 diabetes. Cost is also a significant factor. And so caring for folks with diabetes on average is 2.3 times higher than for folks that don't have diabetes. And you can see here it's over 20% of healthcare spending. And then finally, we wanted to just briefly mention certainly the impact of COVID-19 and the times that we're in right now. And while this is as of May, the end of May, among COVID cases in the US, the two most common underlying conditions were cardiovascular disease and diabetes. And we know from all that has been looked into over the last several months that hospitalizations are higher. They're 6 times higher among patients with a reported underlying condition, as well as deaths being 12 times higher. And so again, really thinking about kind of that management of diabetes. So if we move on to the next slide, really wanted to start to talk about the landscape. And so, some of you may have solutions in place, some may not have any solutions in place across what we look at as the spectrum of diabetes. And so that's from prevention to management to that type 2 diabetes reversal. So some of the questions, that you would want to ask yourself are, do we have a clear understanding of the prevalence of metabolic syndrome or prediabetes or diabetes in your workforce? Oftentimes it's, a lot easier to get to that number for diabetes, but you can also estimate for things like metabolic syndrome. That typically doesn't come across as easily through carrier reports as something like diabetes would, but you can get to an estimate based on your population. Has the impact of COVID on employees managing their diabetes been a concern within your organization? If you have programs in place today, are they driving that meaningful engagement that you're looking for? Are they reducing risk? Are they positively impacting your population? Are the current programs working together? So programs that you have available for folks with metabolic syndrome, prediabetes, diabetes, are they working together for that more simple, effective member experience? And then have you spanned this sort of spectrum that we're looking at here? Across all of these different types of solutions, so diabetes prevention, diabetes management, diabetes reversal for type 2, oftentimes, there's a digital component, a coaching component, remote monitoring, connected devices, and really key here as well, in particular, as we look at sort of the reversal aspect, is that physician support. So for diabetes prevention, again, this could be for people who know they have prediabetes, maybe they have metabolic syndrome, which, again, is that sort of cluster of risk factors with some cardiovascular risk, a larger waistline, and then the high fasting blood glucose. Many of these programs focus on nutrition, physical activity, and certainly the behavioral counseling, very behavior to change type of focus. For diabetes management, this is really support in managing your diabetes and really focusing on, helping regulate blood glucose, A1C, which is that measurement of your average blood glucose over the last couple of months, cardiovascular metrics such as blood pressure, lipids, vascular function, also looking at kidney function. And this oftentimes does involve some remote monitoring, maybe for, blood glucose, if there's comorbid conditions, potentially also for blood pressure, and then for weight as well. And then that strong coaching component too. Certainly many times, that might involve a certified diabetes educator and that diabetes care team. And then this last bucket of the type 2 diabetes reversal, often focused on nutrition and weight loss. And this is, again, where it's very important that that care team is surrounding the member. And so, you know, as was mentioned earlier, as we think about type 2 diabetes reversal, a lot of that is reducing or eliminating the need for treatment. And so having that physician support as folks are going off their diabetes medications. And so Virta, you know, certainly covers with it across the spectrum as well. And what I really wanted to just maybe focus a minute or two on before I hand it over to the next panelist is we're going to talk a little bit about, you know, these 7 organizations or these 7 clients and the pilot. And so if you're thinking about, you know, do we want to do a pilot type of a program? You know, the first question we want to ask is, what really are the goals of the pilot? Is it about testing the solution, seeing if, you know, what the employee experience might be? How do you structure the pilot? There's multiple ways to do this. You know, some of the things that we see are kind of that first come, first serve in terms of there's, you know, X number of slots. And so that many people get to the first that raise their hand are part of the pilot. Sometimes it's offered to a specific portion of the population, maybe those that are most at risk. Some employers we've seen when there's, say, for example, they have multiple medical carriers and have a partnership with a solution, partnering with that vendor for that population. If you have an on-site health center, piloting within that group, that's a nice kind of control group way as well. So, you know, first question is, why are we thinking of doing this pilot? Second is, how is the pilot structured? And really, as we think about it, what are some of the benefits of trying to pilot a new solution? Certainly having the opportunity to try it out, less risk as you're trying it out on a limited basis. Certainly benefit to the members that have that ability to participate in the program. And then depending on, you know, where the solution is, it could also allow you to be a part of future development. So if the solution is very new, your ideas can help shape that solution, which can certainly be an exciting thing as well. So with that, I will turn it back to Britt to introduce our next speaker.
Awesome. Thank you, Kara. Next, we have Dr. Jeff Stanley, who is a medical director here at Virta Health. He's going to be sharing Virta's clinical outcomes that, again, we've aggregated across 7+ employers in a pilot cohort. So, Jeff, over to you.
All right. Thanks, Britt. Just taking control of the screen here. Okay, so again, I'm Dr. Jeff Stanley, medical director with Virta, and also a practicing physician. So I treat our patients across the country and have the opportunity to be able to see these really transformative outcomes and to be able to take people off of medications and see their blood glucose and A1C improve. So I'm going to go into some of the specific results that we've seen amongst this employer cohort. And just for a little bit of level setting and background, again, this pilot was with 7 employers in collaboration with Willis Towers Watson. And the employers really run the spectrum, so 12,000 to 52,000 employee groups, so large employers and industries including technology, material science, home appliances, shipping and packaging, education, and healthcare. And just to kind of touch on that, I mean, that's something that we have seen in our experience over years and in working with a variety of clients, and that we see very similar and consistent results across a whole spectrum of patients. So people that are blue collar, white collar, folks that are working from home, or those that are essential employees. And really the high touch model that we offer allows us to kind of meet people where they are. And again, give this physician supervised, highly interactive health coaching experience for our patients. So for just a brief bit of background on these pilots, basically, you know, we start with an employer, have a launch where marketing is sent out to employees. One of the things that we've done with many of our pilots is to have a quick meeting where at 90 days where we're able to report back results. And this is something that's been very important because people get to see the rapid impact, the way that patients are getting off of 40 to 50% of medications even at 90 days and seeing improvements in their blood glucose and A1C at the same time. And then it's an ongoing discussion with clients as to when to expand the pilot, you know, again, which particular patient populations we might want to target, and really working to kind of have a bespoke intervention for that individual client. as we get reconnected here and share our screen, a couple of the things that we're looking at with these pilots. So, we really look at a couple of success metrics, and these are in line with actually our performance guarantees that we offer to our clients. And one of the important things that's a little bit different about Virta is that we go 100% fees at risk, and we are able to basically put our fees at risk for hemoglobin A1C improvement, weight loss, and prescription change. And if we don't hit those marks, we refund a portion of the costs. In addition, we also are working to kind of figure out the patient experience and also share that data back with the employers. And so what that allows us to do is oftentimes employees will be reaching out directly to their HR manager with the amazing success that we've seen, and we're able to see patients like Ty and Robert, who will share their experience in a second here, to be able to just let the HR folks know the really strong impact that's made. So now I want to go into some of these outcomes and kind of compare and contrast to some of the usual care or diabetes management that can be seen. So as Kara had mentioned before, there's sort of a range of options that are available to employees. And when we look at in the center here, usual care, so that's what most employees are experiencing, where they're seeing an endocrinologist or a primary care physician and a dietitian and working on some lifestyle changes, medication management. And generally what's seen in usual care, and this was actually seen in our clinical trial in a group of patients that we followed who were getting standard care in the community, what's generally seen is a slight increase in hemoglobin A1C. Again, as a quick reminder, A1C is the 3-month measure of average blood glucose. So over time, people tend to see a slight increase in their hemoglobin A1C. They see weight loss or no weight loss, or sometimes a little bit of weight gain. And generally, unfortunately, they see a slight increase in prescription medications. So that's the standard experience, unfortunately, for most patients, is this slow and gradual increase in their glucose and increase in their medications. Then on the right side here, when you think about a diabetes management digital solution, so several of those out in the market. And what's seen there is a little bit better hemoglobin A1C improvement, generally no weight loss on average. And again, what we see here is an increase in prescription medications. And the take-home point here with most digital diabetes management options is that it's about nudging people to check their blood sugar, reminding them to take their medications, and improving blood sugar by increasing medications over time. And in comparison, if you look at the cohort outcomes on the left here, again, at 180 days with Virta, we saw an average of 1.4 drop in hemoglobin A1C, 9% of body weight loss, and prescription medications, diabetes meds, a reduction of 64%. So these are happening in conjunction. So people are improving their weight, they're improving their glucose while they're simultaneously coming off meds. And that's being done again by our physician supervision. So again, looking at the hemoglobin A1C reduction, I wanted to show this in another way. So this looks at the glycemic control or hemoglobin A1C in this cohort of patients. And what you can see at baseline is 33% of patients had a hemoglobin A1C of greater than 8.0%. So that is considered poorly controlled diabetes. That puts people at a higher risk for complications of diabetes like heart attack, blindness, amputations, dialysis. In addition, as we've seen with COVID, is it also puts people at a higher risk of morbidity and mortality from COVID-19. So this is something that it's not just a long-term concern, it's actually a short-term concern as well, in that we want to improve people's glucose as quickly as possible to get them out of this high-risk range. And then if you can see on the left side, with the hemoglobin A1C in green of less than 6.5%, only 14% of patients at baseline had this A1C that's below the diabetes threshold of 6.5. And in the majority of those patients, that was being done by taking a number of diabetes meds. And in comparison here, if you look at the results at 180 days, what you can see is that this high-risk group of people of A1C of above 8.0% went from 33% of the group down to 5%. We saw similar reductions in the 6.5 to 6.9 and 7 to 7.9 group. And you can see this huge increase in the number of patients or percentage of patients in the very well-controlled or reversal category. So we went from 14% of patients with a hemoglobin A1C of less than 6.5% to 73% of patients. And again, this is while reducing medications. Now, also to touch on weight loss. So just briefly to orient you to this graph shows weight loss in a variety of populations that we've worked with. So in the light blue, that is with our Virta clinical trial, an ongoing 5-year clinical trial in Lafayette, Indiana, where people lost on average of 13% of body weight at 1 year. You can see in dark blue, that's with our larger book of business enterprise population, very similar trajectory. And then in red, you can see with this Willis Towers Watson cohort that people lost on average of 9% of their body weight. You can see that they started a little bit lower in weight than these other groups, but the results are very consistent across populations. And the one thing that's really important to note here is that losing 5% of body weight is considered kind of the gold standard in terms of the amount of body weight to lose to get lasting health benefits. So a number of studies have showed reductions in cardiovascular disease, fatty liver disease, other health issues just by losing 5% or more. And we really focus on losing that weight and then helping patients to keep it off as well. This slide shows the reduction in diabetes medications. And what this shows, again, dark blue is with our enterprise book of business, and red is the Willis Towers Watson cohort. And you can see that they're very consistent. And what we see is that 64% of diabetes-specific meds were eliminated in this cohort by 180 days. And this is done as glucose improves. It's done to help patients stay safe, because if glucose improves quickly and someone is on, say, insulin, for instance, that needs to be reduced. Otherwise, people could be at risk for low blood sugar, which can be dangerous. And the other thing to touch on here, if you see on the right, is that insulin overall dosage decreased by 78% for pilot patients by day 180. So the entire number of units of insulin that this group was using reduced by 78%. So if you can imagine to expand that to a larger cohort of patients, the amount of money you can save by reducing that amount of insulin. The other thing that I think is really important to touch on here is that this is also really transformative for patients. And Ty and Robert will talk about this a little bit, but being able to take control over your health, to be able to have a normal hemoglobin A1C while stopping medications like insulin, to be able to stop giving injections multiple times per day or taking medications over and over, it's really empowering to people. And it's a reason why we have very high retention over time. And this is, I think, a slide that got skipped when we lost our connection there, but we saw a 91% retention of these patients in the cohort. So people are sticking with this despite a very trying time with COVID and what everyone's been going through. And we found that the ability to practice telemedicine, the ability to message with patients while they're at work or they're at home, really allows for this high number of touches that keeps people engaged and keeps them successful. And then finally here, this is just to kind of reiterate the point that our results are validated across different geographies, industries, and demographics. So just to touch on a couple of our clients that we work with. So US Foods, which has a large number of truck drivers that are traditionally hard to reach and honestly can be hard to get to adhere to lifestyle changes or medications. We saw remarkable improvements in that group. Remarkable improvements with Nielsen, with more knowledge workers, county workers, university workers with Purdue University, and also an ongoing partnership we have with the Veterans Affairs, where we're seeing patients that live in rural parts of the country or have traditionally had difficulty sticking with medications or seeing these medications or these improvements in health. And we're able to work with these patients and see very similar results. So again, I'll pass it off now, and also we'll be around at the end for questions.
Awesome. Thank you, Jeff. Next up, we have Chris Rukus, formerly Benefits Director at Sealed Air and recently made a transition to Benefits Director at Honeywell. So congratulations, Chris. Chris is going to be sharing more about his experience working with Virta back at Sealed Air and how he was able to bring the Virta treatment to his population. So welcome, Chris. All right, diabetes is obviously a big global epidemic. So how big of a problem was it at Sealed Air?
So at Sealed Air, diabetes along with musculoskeletal claims were the two biggest claims drivers for our medical plans. And I'm sure a lot of people on the phone who are HR operations group probably have heard this before, probably seen it in their own claims history. So we noticed that trend was going in the wrong direction. And we decided that we wanted to see what point solutions were out there that could help us turn the tide on that projected outcome of claims that looked like that they were going up, and we wanted to make sure that we try to reverse that.
Awesome. What's been, Chris, your history working with diabetes vendors and then addressing the epidemic maybe before you came to the Virta solution?
So I can't say that I've actually worked with any diabetes management vendors such as Virta before. Obviously, our medical carriers did have disease management programs and case management that assisted employees in need, but nothing so specific like a point solution like Virta before.
All right then. What makes Virta different from maybe the traditional diabetes management in your eyes of what you know of it, and why is this, is that important to you?
I think that the traditional, disease management platform can be more reactive in nature. They want to keep the situation that an employee's in, from getting worse, right? So they're trying to keep people going to the doctor, seeing the doctors, making sure they're taking their prescriptions, so that the problem doesn't get worse. Whereas, with Virta and this point solution that we introduced this past year, obviously we're trying to reverse the diabetes epidemic, and to get employees off of those, or at least reduce their pharmacy medications. The focus appears to be more on a behavioral change with Virta. So with the result being improved overall health, as well as weight loss, drop in blood sugar, et cetera. So this type of point solution to us just looked like a different way of looking at that same problem and actually trying to do something more substantial about it to give somebody just an overall improved health. That seemed to be the driver of this when we were looking at point solutions for this problem.
That's awesome. It's obvious we have shared goals is to help people get healthier through behavior changes. And making lifestyle changes that stick. So that's awesome. Right. What's been the response from your participants to Virta? Like, what really stood out to you?
Okay. It was an overwhelmingly positive response. When we started the pilot, and that was probably about a year ago that we started that pilot, after 6 months, during that 6 months, we were getting, Virta was sending us information regarding testimonials for some employees that were in the pilot. And they were just overwhelmed at the opportunity to be able to get themselves healthier. That was really the situation there. The fact that they were, losing weight, which be able to, they were more active. They were able to play with their kids more, play with their grandkids more. Just their outlook on life was so much better. And this, of course, is pre-pandemic. And it was great to see, as an HR professional for over 20 years now, and I'm sure a lot of the people on the call today are in my same situation, where sometimes you see people at their worst, being in the HR profession, and to be able to see this was very refreshing, and I actually kind of relished it, just being able to see the people coming back saying, wow, this is just incredible how much this is changing my life. Obviously, it's even important today, during the pandemic, but even beforehand, you could tell that there were people out there that needed the help. They hadn't been getting it from the traditional means of disease management or diabetes management, and this was like a wake-up call. This was like a lifeline to them.
Well, that's awesome. You may have already sort of covered my next question a little bit within your answers, but I'm going to
Okay.
ask it very, very point blank. What were your biggest lessons from the experience, and why are they important now more than ever in light of the COVID pandemic?
So in light of the pandemic, I mean, it's well documented. I think Kara actually spoke to this earlier. You know, for those with pre-existing conditions, I think one of the underlying conditions, diabetes, was 30% of those that have COVID. So the more we can, you know, assist people in reducing or eliminating those pre-existing conditions, you know, the better off we are for the general population's health. To be able to, it seems like Virta Health has a process in place to help reduce, you know, the number of people with those pre-existing conditions, and that is, like I said earlier, a lifeline, you know, for those struggling with diabetes. So it was definitely a learning experience, knowing that there was people out there that needed the help and they were able to take this on. We implemented it, you know, in July, and as of, you know, a couple months in, we had, you know, over 100 people enrolling in the program. So outside of the pilot, we knew just by the results of the pilot that this was something that was a no-brainer. At the end of the day, there was a very big upside, even from a PR perspective. You know, when the company's putting this forth, and at Seal there, we decided that we were going to charge employees for this. So when you have something like that to the employees, and then you get all this positive back, you know, that's great. I mean, that's what you, as an HR professional, that's the kind of thing that keeps you smiling.
Oh, thank you, Chris. Anything else you want to share with the group?
I would say, I would think if you're thinking about implementing something like this, as long as your HR operations team on the ground is fully engaged in this, because a lot of the HR people will know some of these people that have diabetes or, you know, have some sort of disease management issue. It is a personal thing, and sometimes just sending an email out to employees, they may be a little nervous about, you know, going forward and taking that next step. So having the local HR people on board with this, to be able to push it to those people that they think would obviously benefit from this type of program, I would encourage them to make sure that their HR people are on board with it to help them through
Thank
the
you so much,
implementation of this type of project.
Sorry about that. Thank you so much, Chris, for sharing with us today. And also, I want to say thank you. You know, as a benefits director, I know you you take on a lot, and one of our favorite things that we love to do is share back the appreciation to the benefits departments that we hear from our patients. We hear it all the time where patients will tell us, thank you so much. I went to my HR leader. I'm so grateful. And I think it's just awesome to share in that excitement for what you're bringing to your employees. So thank you.
Oh, thank you.
All right. Next up, we are honored to be joined by two of our very own Virta patients who have volunteered to share their personal stories. First, we have Ty, a proud father of two wonderful kids, Christopher and Caitlin. He's an engineering specialist with a love of the outdoors, and he's here at Virta for a better quality of life. And part of that, he says, is really continuing to get to enjoy an active outdoor life. So Ty, we're so grateful to have you join us here today. I'm going to turn it over to you because you'll tell your story far better than I could. So thanks, Ty.
Sure. Yeah, my name is Ty. I've been diagnosed with diabetes for over 20 years. And with my situation with diabetes, hereditary, sure, my mom and some siblings have it. Other issues could be food choice, maybe, or not as active lifestyle, maybe a little bit of everything, I guess. But regardless, after the diagnosis, my family doctor did send me to diabetes education. And of course, he continues to monitor my progress, but my numbers were always bad. Blood glucose was high. Low carb diet wasn't really working out for me. My A1C was sporadic, lots of ups and downs. but rarely were in the good range. The number of my prescriptions keep on going up as time goes on. Um, so looking back before my treatment with Virta, I would say that my health was in a, a downward spiral. It was a huge struggle to control my diabetes. So I try my best to maintain to stay away from complications of onsets of diabetes. So with my doctor, for example, he would say, go walk like 10,000 steps a day. And I would do that, and I still maintain the low carb diet. And yeah, being in the scientist in the engineering field, doctor, I'm listening to to your teaching, but my numbers or the diabetic education wasn't cutting it, is what I told him. So I keep on asking, what else is there? I'm doing everything that I can, and at the moment, towards the end of my diagnosis with my doctor, I was experiencing typical symptoms like blurry eyes and the numbness in the foot, foot and the leg. And then my doctor requested a retinopathy test, telling me that blindness is a real concern. Scare tactic or not, it worked. So how I found out about Virta is one day the company that I work for through the HR was asking me, hey, do you have diabetes? Would you like to eliminate the diabetes related medication? And would you like to reverse diabetes? And to me, it was a, a simple, definite yes. So signing up was the way to go for me. And so I signed up and got approved to take the treatment. And when I started with the treatment, Virta provided education, a lot of insightful videos, a lot of trainings. It basically fills the gaps of why just maintaining the low carb diet for me still gave me high numbers. And even skeptical when I first start, I just want to see how, if I follow this recommended diet, to see if my numbers does improve or not. So part of the success that I contribute to Virta and my improved diabetic life is to my coach. Lee has been a blessing. She was always there for me 24/7. Maybe I didn't text her at 4 a.m., but she would have respond. I remember texting her back and forth, you know, while taking pictures of food label and, hey, say, why is stevia, what's the difference between stevia and Splenda? And she gave me the answer. And then another example is being Asian, the food choice for me was challenging. And the example that I had the conversation with my health coach was regarding spring rolls. And the ingredients in spring roll has, for example, like the vermicelli, which is the rice noodle, the spring roll wrap, and the sugar and the soy sauce. And for the numbers person in me, I saw that eliminating each one of those did correlate to the decrease in blood sugar. So to me, it was the training and how I implement the training into having better food choice to help me control my diabetes. Also, my health coach also pushed me a lot. For example, I told her about my 10,000 steps. She bumped it up to 12,000. And lastly, I would like to say that I've been on Virta for 11 months now. And towards the end of before I started Virta, the number of medication that I was taking was 6 of them. And now I have eliminated half of those. So I can see that continue on this path. My end goal would be a medication-free, hopefully to have a total reversal of my diabetes. And thanks to Virta, I now have the tools to accomplish my goal.
Thank you so much, Ty. You are certainly well on your way to diabetes reversal in just 11 months. So possibilities are endless. We appreciate you sharing your story. All right, so now we have our next patient, Robert. Again, we're so honored to be joined by our patients. Robert, thank you for being here. As of today, I know that it's been 356 days since you started making nutrition changes with us here at Virta. So you are just shy of your 1-year anniversary. So I want to be the first to say happy almost Virtiversary to you, Robert. Robert comes to us and is going to share his story about his experience. So Robert, over to you.
Well, hi, everyone. Yeah, I have a story that's typical, I would say, and very similar to Ty. I was diagnosed also about 20 years ago. I've always had issues with my weight ever since I was young. Probably due a lot to the fact that my family is very good at cooking and eat very rich foods. I mean, I'm Hispanic, so you know, tortillas are part of my life and things like that. And you know, our eating habits weren't always the best, especially knowing what I know now. I mean, that's you know, we're raising our kids to try and be better. And one thing I will say is that this has given me a really good example to show my kids. They've seen my transformation. My wife is following along with me. She's lost 70 something pounds, 75 pounds, I think. But, you know, it puts it on us. It allows us to show them we made some bad choices and we're trying to do better. And this program works. I mean, we've both lost, between the both of us, over 150 pounds. I'm completely off my medication. And it's been life-changing. And there's a lot of reasons for that. One of them is, well, the program itself. The tools that they provide are, I mean, they think of everything, you know, food scales. I do my blood pressure every day, things like that. And you know, having the app is also, I think, crucial to the program. It's got action lists that keep you on track. It's got recommendations. It's got little habit forming actions that really become a part of your life. You know, for one, sleep is a big deal. And, you know, at first I kind of blew the sleep thing off. I'm kind of a night owl, so I didn't really, you know, but Lauren, my health coach, she was just, you know, she really tried to let me know, hey, this is really important. She would send me information on it, videos or just resources on it. And it helped me understand it. And then the more that I did it, I realized that I felt better and that my numbers were going up. And, you know, so they think of everything. Everything is there. They set you up for success. And I think that's what I'm most appreciative of, is that they provide you with the tools you need to do that. You know, it's been a big transformation. My family has been amazed by it. Now this happened, I started, you know, to lose weight pretty quickly. And within 6 months, I was down. I was at my goal weight. And so much so that I asked Lauren, my health coach, like, how do I stop this? Because I'm, you know, I'm a little on the thin side, you know, and so, you know, that's what I'm working on now is maintenance. She's working on me with maintaining and sending me resources for that. And it has changed our lives. One thing that I think that is important, and it's kind of something that people don't think about or really focus on is the weight loss is kind of icing on the cake. You know, my goal here was my diabetes. I've had it for a long time. I've tried, I took all the medications. I tried everything that the doctors told me. Sometimes not, you know, not perfectly. But I noticed with the medications, I gained weight, you know, and it was, I mean, extremely frustrating because, you know, I live out well outside of Houston. We have a garden. We're active people. And I wanted to be more active, and it was like the medication was counterproductive, you know? And so, you know, it was just, it was a really frustrating thing. But one of the things that I found that was most important about how I was feeling, besides the weight loss and the diabetes going away, was my mood. My mood was better. You know, I had the energy. I have the energy. I have the focus. I'm way more productive at work. I mean, so much so that my coworkers are like, you know, you're making us look a little bad. Can you just settle down a little bit? You know, but my mood is better, and that affects things in a way, like with my kids, my relationship with my kids, my patience, my relationship with my wife, her mood is better, you know, and then with my coworkers, I mean, everybody that's in my life, it affects them because my interaction is better with them, you know, and it really kind of, I just think it's something that people don't really realize, and I think it's important because that also is motivation to keep going and continue the program. You know, it really is. And coming back to the tools that and the resources that they provide, one of the things that my wife and I both realized kind of separately, and we both one day she was like, you know, do you look forward to checking your numbers? And I was like, yeah, I do. And I do it twice a day. She does it once a day. And I still do it twice a day because I want to know where I'm at, you know, but I check them in the evening, right before dinner, about 6 o'clock. And that's another thing. We're on schedule. This is like, we're eating at a certain time every day. We're eating simpler, and it's not a huge ordeal because we love to cook and eat. And before it was like a production, you know, now it's just a little bit simpler without the desserts and without all the side dishes and that kind of thing. You know, food planning gets a lot easier. So, but I would check my numbers at 6 p.m. and it basically it holds me accountable in a way. It makes me think about what I did throughout the day for that number to be low or high, you know, and it confirms the way I'm feeling, because there are times where you're doing this low carb lifestyle and you feel like you can feel the energy inside you. You know, sometimes it even comes out in the form of heat, like you just got all this energy, and it really, it just confirms that, yeah, I think I'm burning. I think I'm losing weight. I think I'm, you know, and then when I check my number and it's a nice number, I'm like, well, I was, you know, I did well. What did I eat today? What did I do to get to that, you know? And so, you know, it's been a wonderful journey. I think the other point I want to make too is that it's been sustainable throughout COVID, you know, throughout the pandemic. It's sustainable for a lot of reasons. One of them makes grocery shopping a lot easier. It makes cooking a lot easier. And, you know, I don't feel deprived. I don't feel like I'm on some sort of diet or anything like that. I eat I eat well, and I feel good, you know? I mean, what more can you ask for, you know? So it really, one of the things I want to also express is that my health coach, Lauren, has been an amazing, amazing resource. She'll answer questions any time of day. It doesn't matter how big or small the question. She's sending me resources. There was an incident where my doctor was concerned about this and was asking questions, and I thought it was a good question. And so I went to Lauren. She answered it right away. She knew what the answer was. And then she sent me documentation. And she was like, please show your doctor this, you know, like I want him to be informed and I want him to be a part of this process. And so I did. And my doctor literally was like, I'm going to look into this. This is interesting, you know. The other thing about my doctor is that, and I've been with him for quite a while, and he is in our practice, he's a diabetic specialist. And because of the way the pandemic fell and the scheduling of my follow-up visits with him, I hadn't seen him for 6 months, which usually I go every 3 months. When I saw him, he was just blown away by my weight loss. And he, you know, doctors are busy and they're usually in and out, and it's sometimes pretty quick, but he sat down with me for about 20 or 30 minutes and took notes and asked me a ton of questions. And so, you know, it's just a testament to the progress that I made and the results. And I can tell you, it's not hard to maintain. I'm somebody that loves food. And, you know, we have a garden here, we have chickens, we have things like that. Like, we love food and I don't miss anything. You know, my wife, she actually has a side business where she makes tamales and kolaches at home. And I can sit, she's making some right now. I can sit here and watch her and not even be tempted. And she's not as well. And that's saying something. So, but back to my health coach real quick. I just want to say thank you to her. Thank you to Dr. Dumont. Coach Lauren has been great. And I just couldn't ask for anything more. And if you're considering the program, I highly recommend it. And I just, you know, it's just been a great journey. And I thank Virta and Rice University for the opportunity.
Well, thank you so much, Robert, and to Ty. Like I said, you both said it far better than we could. One thing I heard from both of you is about the support that you get, and we know that change is hard. So while our recommendations and our treatment is evidence-based, science-based, we know that the support from a coach and safety supervision from a physician is absolutely critical, and you both highlighted that. So thank you so much. I'm going to bring all of our panelists back now, so if you could all show your face, come off of mute. I'm going to ask some questions here from the crowd. Our first is for Kara. There is a gamut of telemedicine providers out there. How can you differentiate between the good care from great care? What have companies been doing to integrate solutions across multiple disease areas?
Thanks, Britt. I heard the part that cut out for me, the difference between what care and what care. Sorry, I want to make sure I understand the question correctly.
Good and great care.
Got it. I think, you know, a couple of things. I think, you know, the really focused care is certainly important. I think as we think about the virtual component, being able to also surround folks with a larger care team, but also surrounding folks with solutions like coaching and like the app that they have, you know, if they need something when they're out at a restaurant to be able to say, hey, you know, what do I want to eat? So really having that care that thinks about, you know, not just transactional care, but more supporting an individual, you know, throughout their journey.
Awesome. All right. Thank you. Okay. So for Dr. Stanley, what is the medical definition of diabetes reversal? And is Virta Health in collaboration with the ADA, American Diabetes Association?
Yeah, so diabetes reversal, it's a little bit of a newer term. It has been used with another example would be the DIRECT trial, which is a meal replacement option that's been done in the UK. But the definition behind it is basically hemoglobin A1C of below 6.5% without being on diabetes-specific medications. And then in addition to reversal, we also track remission in our patients, which is basically prolonged A1C below 6.5 and remaining off of all the meds. And with regards to the American Diabetes Association, so as Britt, you had mentioned the clinical trial initially, and I touched on it a little bit, but one of the things that was exciting was that in both the 2019 and the 2020 guidelines from the American Diabetes Association, our clinical trial was cited as evidence that low carbohydrate medical nutritional therapy is a safe and effective option for type 2 diabetes, also cited in the nutritional recommendations. And then just as another quick aside, our Chief Medical Officer, Dr. Bob Ratner, was the Chief Medical and Scientific Officer for the American Diabetes Association for a number of years. And he joined Virta because he saw the transformative outcomes that we've been able to offer, and saw the opportunity to offer this at scale to patients all across the country.
Okay, this next one is also for you, Dr. Stanley. So have any patients using the Virta treatment been tracked beyond the first year? And what does long-term success look like?
Yeah, so we have quite a few patients that are several years out into the Virta treatment. Again, with the clinical trial, which is peer-reviewed and published, we've published results from 1 year and 2 year. We've also put out a 3.5-year abstract, and we'll be shortly publishing a 5-year data as that continues to come in. But in addition, we also have enterprise patients that have been with us for about 4 years now, and people who have been able to maintain their success throughout time. I think one of the things that's important to note is that it's not always a smooth journey. You know, we know that some people just immediately hit the ground running and never look back. Their glucose is perfect. Other people, and particularly during COVID, you know, may hit some struggles. And part of what we're able to do is see when that happens and intervene quickly with our health coaches and our physicians, and allow people to get their glucose back on track, ideally without having to add back any medications.
Thank you. Okay, I know we are almost at time here. We're going to sneak in another question for Chris. So how did you encourage employee participation and engagement in Virta from a benefits perspective?
So, you know, for the pilot, what we did is we really just did communications out from our corporate communications group. And we also worked with the local HR people on the ground at our several locations across the U.S. And, you know, we actually got on a call with them saying, hey, this is something that, you know, somebody you may know in the HR in your space, maybe somebody that could benefit from this program. We're trying this out to see if this is something we want to, you know, broaden to the entire corporation to have access to. And you know, I think that was probably the most effective way of trying to find people that would be interested in this, because having that local HR support was definitely paramount to having success in getting this, not only the pilot off the ground, but once we saw what had happened with those people in the pilot and the results we were getting, and it was, like I said, it was a no-brainer to expand it to the rest of the company.
Oh, thank you so much. And thank you to all of our panelists here today. And of course, to all of you out there in the audience. There were so many great questions. We know we didn't get to all of them. If you do have a question you'd like answered, please email us at partner@virtahealth.com, and we'll do our best to get back to you in a timely manner. Also, we had a number of questions asking about a recording. This webinar recording will be made available offline or online, so be on the lookout for that. And if you're interested in our next webinar, please sign up. It's on December 10th, and we'll be talking about our virtual clinic expansion. So super exciting. Again, one more thank you to all of you and all of our participants here today. I hope you have a great rest of your day. Bye all.